Coronavirus India Information and Advisory Existings and latest amendment from September 1, 2021 for international arrivals to India. In the context of COVID-19, Government of India is following point of entry procedures for identifying international travellers, particularly at-risk travellers to India through multi-pronged strategy of thermal screening and testing. There is increasing evidence that the mutant variant of SARS-CoV-2 are in circulation in many countries, and these mutant variants are driving the pandemic in their country of origin. So far, the 3 SARS-CoV-2 variants in circulation, UK variant, South Africa variant, Brazil variant, have been detected in 86, 44, and 15 countries respectively. All 3 variants have demonstrated increased transmissibility, as reported by World Health Organization. Ministry Health of Family and Welfare in consultation with Ministry of Civil Aviation has reviewed the situation with regard to point of entry actions required to minimize the risk of importation of mutant strains of SARS-CoV-2. This document link given in the description addresses all the actions that need to be taken in 2 parts. Part A. Standard operating procedures for all international travelers coming to India. Part B. Additional procedures for those coming from United Kingdom, Europe, and Middle East. Part A for all international travelers except travelers coming through flights originating from United Kingdom, Europe, and Middle East. A.1. Planning for travel. A. All travelers should submit self-declaration form on the online ABUSIVE portal www.newdelhiairport.in before the scheduled travel. B. Upload a negative COVID-19 RT-PCR report. This test should have been conducted within 72 HRS prior to undertaking the journey. Each passenger shall also submit a declaration with respect to authenticity of the report and will be liable for criminal prosecution, if found otherwise. 2. They should also give an undertaking on the portal or otherwise to Ministry of Civil Aviation, Government of India, through concerned airlines before they are allowed to undertake the journey that they would abide by the decision of the appropriate government authority to undergo home quarantine or self-monitoring of their health for 14 days, or as warranted. 3. Arrival in India without negative report shall be allowed only for those travelling to India in the exigency of death in the family. 4. If they wish to seek such exemption under Para 3 above, they shall apply to the online portal link given in description at least 72 hours before boarding. The decision taken by the government as communicated on the online portal will be final. 5. Before boarding, do's and don'ts shall be provided along with ticket to the travelers by the airlines or agencies concerned. 6. Airlines to allow boarding only those passengers who have filled in the self-declaration form on the ABUSIVE portal and uploaded the negative RT-PCR test report. 7. At the time of boarding the flight, only asymptomatic travelers will be allowed to board after thermal screening. 8. All passengers shall be advised to download Arogya Setu app link given in description on their mobile devices. 9. Suitable precautionary measures such as environmental sanitation and disinfection shall be ensured at the airports. 10. During boarding, all possible measures to ensure physical distancing are to be ensured. A.3. During travel. 11. Suitable announcement about COVID-19 including precautionary measures to be followed shall be made at airports and in flights and during transit. 12. While on board the flight, required precautions such as wearing of masks, environmental hygiene, respiratory hygiene, hand hygiene etc. are to be observed by airline staff, crew and all passengers. A.4. On arrival. 13. Deboarding should be done ensuring physical distancing. 14. Thermal screening would be carried out in respect of all the passengers by the health officials present at the airport. The self-declaration form filled online shall be shown to the airport health staff. 15. The passengers found to be symptomatic during screening shall be immediately isolated and taken to medical facility as per health protocol. 16. The passengers who have been exempted for pre-arrival RT-PCR testing, as approved and indicated on the online portal in advance, will show the same to the respective state counters. They will be prioritized for sample collection in the designated area, samples collected and permitted to exit the airport. They shall monitor their health for 14 days, subject to negative test report of the sample taken at the airport that would be conveyed to such travelers by the concerned state authorities/airport operators. 17 All other passengers who have uploaded RT-PCR negative certificates on ABUSIVE portal shall be allowed to leave the airport/take transit flights and will be required to undertake self-monitoring of their health for 14 days. 18 All such passengers will also be provided the list of the national and state-level surveillance officers and the respective call center numbers, so as to inform state or national call centers in case they develop symptoms at any time during the quarantine or self-monitoring of their health. 19 International travelers arriving through seaports or land ports will also have to undergo the same protocol as above, except that facility for online registration is not available for such passengers currently. 20 Such travelers shall submit the self-declaration form to the concerned authorities of Government of India at seaports or land ports on arrival. Part B. For all international travelers coming or transiting through flights originating from United Kingdom, Europe, and Middle East. All the clauses as above shall be applicable to such travelers coming or transiting from flights originating in United Kingdom, Europe, and Middle East except for clauses on testing, quarantine and isolation as specified below. All international travelers coming/transiting from flights originating from United Kingdom, Europe, and Middle East as described in the scope above should submit self-declaration form for COVID on the online ABUSIVE portal link given below before the scheduled travel and will be required to declare their travel history, of past 14 days. 1 While filling SDF, apart from providing all other information required in the SDF, passengers need to select a. Whether they plan to disembark at the arrival airport or take further flights to reach their final destination in India. B. Based on this selection, the receipt of SDF will display T, transit, in easily readable and bigger font than other text. C. The passengers will need to display this receipt to state authority or government officials at the airport for segregation. 2. Keeping in mind the testing requirements for passengers from UK, Brazil, and South Africa, who have to take connecting flights, airlines should keep the passengers informed about the need for transit time of a minimum 6 to 8 hours at the entry airport, in India, while booking the tickets for connecting flights. 3. All the passengers arriving from United Kingdom, Europe, and Middle East shall be carrying negative RT-PCR test report for which test should have been conducted within 72 hours prior to undertaking the journey. The same also shall be uploaded on the online portal www.newdelhiairport.in link given in description. 4. Airlines to allow boarding only those passengers who have filled in the SDF on the ABUSIVE portal and uploaded the negative RT-PCR test report. 5. The concerned airlines shall ensure that prior to check-in, the traveler is explained about this SOP, particularly Clause 9 of Part B of this SOP, besides displaying the same prominently in the waiting areas of the airports. 6. Airlines should identify the international travelers arriving from or transiting through United Kingdom, Brazil, and South Africa, during past 14 days, and segregate them in flight or while disembarking to facilitate the authorities to follow the due protocol in respect of these travelers. 7. In-flight announcements must also be made explaining the relevant information to the passengers. Relevant information in this regard shall be prominently displayed in arrival area and waiting area of the airports of arrival. 8. The immigration officers of these identified airports shall also ensure identification of travelers, from their passports, who originated or transited from UK, Brazil, and South Africa, during past 14 days. 9. All the travelers arriving from or transiting through flights originating in United Kingdom, Europe, or Middle East shall be mandatorily subjected to self-paid confirmatory molecular tests on arrival at the Indian airports concerned, port of entry. Entry made in the SDF regarding telephone number and address would be reconfirmed. 10. Adequate arrangements for passengers waiting for their confirmatory molecular test as well as test results duly following effective isolation may also be made at the airports in conjunction with the airport authorities. 11. The airport authority shall ensure streamlining of the systems for testing at the concerned airports to ensure seamless sampling, testing, and waiting arrangements to avoid crowding and inconvenience to passengers. Once passengers arrive at the entry airport operators should lay down a well-defined flow for such passengers at their respective arrival terminals leading to the waiting lounges and to the exit from the terminal. 12. Airports can provide options to the passengers to do online booking of the confirmatory molecular test through respective website, Air Suvidha portal, or other appropriate platforms, as well as to do offline booking. As far as possible, digital payment facilities to be ensured. 13. Sample collection cum waiting lounge for the passengers should follow all sanitization and physical distancing related guidelines issued by Ministry of Health and Family Welfare from time to time. 14. The states or its government concerned should set up help desks at airports concerned to facilitate implementation of the SOP. 15. Travelers from UK, Brazil, and South Africa taking connecting flights from the arrival international airport, T in their SDF. A. Give sample at designated area and exit airport only after confirmation of negative test report, which may take 6 to 8 hours. B. Those transit travelers from UK, Brazil, and South Africa who are found negative on testing at the airport shall be allowed to take their connecting flights and would be advised quarantine at home for 7 days and regularly followed up by the concerned state/district IDSP. These travelers shall be tested after 7 days and if negative, released from quarantine, and continue to monitor their health for a further 7 days. C. All those tested positive shall undergo the procedure as detailed in Clause 18, below. 16. All travelers from UK, Brazil, and South Africa existing at the arrival airport A. will give their sample in the designated area and exit the airport. They will be followed up by the State Integrated Disease Surveillance Program, IDSP. B. The concerned state authorities/airport operators will collect and convey the test report to the traveler. C. If tested negative, they will remain in home quarantine for 7 days and regularly followed up by the concerned state or district IDSP. These travelers shall again be tested after 7 days and if negative, released from quarantine, and continue to monitor their health for a further 7 days. D. All those tested positive shall undergo the procedure as detailed in Clause 18, below. 17. All other travelers from Europe and Middle East, other than those in flights originating from Brazil, South Africa, and United Kingdom, who have to exit the destination airport or take connecting flights to their final domestic destination A. shall give samples at the designated area and exit the airport. B. The concerned state authorities or airport operators will collect and convey the test report to the traveler. C. If the test report is negative, they will be advised to self-monitor their health for 14 days. D. If the test report is positive, they will undergo treatment as per standard health protocol. 18. Travelers from Brazil, South Africa, and United Kingdom, testing positive, either at the airport or subsequently during home quarantine period or their contacts who turn positive, shall be isolated in an institutional isolation facility in a separate isolation unit coordinated by the respective state health authorities. They would earmark specific facilities for such isolation and treatment and take necessary action to send the positive samples to Indian SARS-CoV-2 Genomics Consortium, INSACOG, labs. A. If the report of the sequencing is consistent with the current SARS-CoV-2 virus genome circulating in the country, the ongoing treatment protocol including home isolation or treatment at facility level as per case severity may be followed. B. If the genomic sequencing indicates the presence of new variant of SARS-CoV-2, then the patient will continue to remain in a separate isolation unit, while necessary treatment as per the existing protocol will be given. The patient shall be tested on 14th day, after having tested positive in the initial test. The patient will be kept in the isolation facility till his sample is tested negative. 19. The state-wise passenger manifest of the flights originating from Europe and Middle East and landing at Delhi, Mumbai, Bengaluru, Hyderabad, and Chennai airports in India for the said period shall be conveyed by the Bureau of Immigration to State Government or Integrated Disease Surveillance Program, IDSP, 2020. All the contacts of travelers arriving from UK, South Africa, and Brazil who test positive, either at the airport or subsequently during home quarantine period, shall be subjected to institutional quarantine in separate quarantine centers and would be tested on the 7th day, or early if develop symptoms. Contacts testing positive shall be accordingly further followed as mentioned in Clause 18, above. 21. Information regarding any passenger covered within the scope of this SOP, who has moved to another state will be immediately notified to the concerned state health authority. If any passenger is not traceable initially or during any duration while being followed up should be immediately notified to Central Surveillance Unit of IDSP by the District Surveillance Officer. International travelers on short stay. 22. International travelers, covered under Part A or Part B, on short stay, less than 14 days, and who have tested negative and remain symptom-free, shall undergo all the procedures as above and shall be permitted to leave India under proper intimation to their district/state health authorities, subject to them fulfilling the requirement of the airlines and destination country. Contacts of the suspect case are the CO passengers seated in the same row, 3 rows in front and 3 rows behind along with identified cabin crew. Also, all the community contacts of those travelers who have tested positive, during home quarantine period, would be subjected to institutional quarantine in separate quarantine centers for 14 days and tested as per ICMR protocol. Note: states may consider, if required, additional requirements with regards to testing, quarantine and isolation as per their risk assessment. The states should however do the same under timely intimation to Ministry of Civil Aviation and Ministry of Health and Family Welfare. Further, states should adequately publicize such additional requirements on their official websites well in advance to avoid inconvenience to the travelers. The travelers destined to a specific state are also requested to refer to state-specific official websites to be well informed about such additional requirements. In February 2021. Further to the GUID lines for international travelers to India on February 17, 2021. Changes in amendment from September 1, 2021 are as follows. Issued by Ministry of Health and Family Welfare on February 17, 2021 issued in view of detection of more transmission-able variants, wherein international passengers were subjected to pre-arrival RT-PCR testing within 72 hours before boarding. As mandated under the said guidelines, only asymptomatic passengers were allowed to board the flight to India. 2. Travelers through flights originating from United Kingdom, Europe, and Middle East were additionally mandated to be tested on arrival in India through RT-PCR test. 3. In view of reporting of new mutations in SARS-CoV-2 and rising incidence of variants of concern and variants of interest, it has been decided to include the following countries in the scope of PAT 13, in addition to the countries already mentioned in the said Part B, of MOFO's Guidelines on International Arrival. A. South Africa. B. Bangladesh. C. Botswana. D. China. C. Mauritius. F. New Zealand. G. Zimbabwe. 4. The amended guidelines shall come into effect from September 1, 2021. Happy journey.